more people join us, that'll be great. We've got a good group of participants already that have logged in. And likewise, we have a great panel that is joining us today that we're thrilled to have with us for this conversation. But let me get a few things under kind of introductions out of the way first. And I want to welcome everyone to our third webinar for Tamio since we started this series back in July. I'm Jay Warren, the Director of Communication and Legislative Affairs for the City of Arlington, and also the Tamio President. And we are thrilled so many of you have joined us for this webinar. We've got also not only Tamio members, but also we've got communicators that are registered through TML that from across Texas that have joined us today as well. You know, we started this monthly series to continue the learning process throughout the year, not just at our annual conference, which unfortunately this year was canceled due to coronavirus. And it's really just a part of not only having continuing learning, but also continued contact and conversation. And we hope that that is something that you are seeing as you're participating in these. Our topic today is coronavirus, something we've all had to deal with day in, day out since I think at least mid-March, if not before then, depending upon where you are. And it's all affected us a little differently. Some cities like Amarillo had an outbreak that was really big, and it dealt with their meatpacking plants. Other cities like Houston and that area, Hidalgo County as well, also record-breaking, record-setting numbers of cases and hospitalizations that also created national headlines. And here in Arlington, we had the first death at a nursing home here in the state of Texas that also brought its own set of headlines, as well as a visit from the governor rather unexpectedly. So we've all had to deal with these things in different ways. And we have assembled a panel of our fellow Tamio members who have some insights to share about how they've coped with those different situations, the opportunities that have come maybe from this crisis. And yes, there are a few opportunities that we've been able to see throughout the course of this. And then some of the curveballs that maybe none of us saw coming. Coronavirus is certainly, I guess, a curveball. None of us saw this virus coming, but we've all kind of planned for emergencies and crises throughout time, and what might we do. And certainly we've got some curveballs that happen as a result of coronavirus. So this is Coronavirus Lessons Learned. Let me introduce our panel. First, we have Shauna Haley, who is joining us as the Communications and Community Outreach Director. She's from the city of Plano. We have Ryan Hunt, who is the Managing Editor for the city of Arlington. We have Devin Sanchez, who's the Director of Communications for the city of Odessa. We have Francisco Sanchez, who is the Public Information Officer for Harris County Homeland Security and Emergency Management. And finally, we have Jordan Schubach, who is the Director of Communications for the City of Amarillo. So a pretty diverse group here that is joining us from all across the state of Texas, and we are so thrilled that they were able to join us here today. And before we get to some questions, let me get a couple more housekeeping items out of the way. First, please use the chat feature or the Q&A feature here on Zoom if you'd like to ask questions, and ask those questions, please, throughout the course of the webinar. I'll be able to weave those in as we approach different topics, and certainly we hope to leave some time at the end also for Q&A. So either one of those features, either the chat or the Q&A will work for that. We are recording this session, and we'll put this up on the Tamio website for you to go back and look, or if you want to have other members of your team look at it as well as a resource. That's why it's all there. So we'll send out a notice on that once it's posted. All right, so that gets housekeeping out of the way, that gets all of our introductions out of the way. Now let's ask the questions. And let me start off with kind of a broad question. What was the biggest surprise, or what caught you most off guard as you started to deal and went through the communication process for coronavirus? And Devin, since you're up in at least my upper left-hand corner, let's start with you first.
The biggest surprise, I guess, was, so the city of Odessa is not the health authority here in our area, it's the county. And so everything was kind of hush-hush. It didn't hit us as quickly, or it hit us a while after it hit everybody else. So we were kind of learning from everybody, I thought, but then once it hit, it was like everything we learned kind of went out the window, and there were a lot of miscommunication steps that needed to take place between the two municipalities. So that was the biggest learning curve, was just kind of trying to get everyone on the same page and the messaging to be the same.
And we're going to talk about that topic here in the future, because I think a lot of us dealt with a similar situation in that front. Shauna, how about you?
For us, the biggest challenge was coordinating internally. We had so many things that we changed all at once: internal policy, internal communications, external facing, and really trying to make all of that happen at exactly the same time, which is dysfunctionally what we had to do, was a huge, huge challenge.
Yeah. Francisco?
For us, I think really just one of the things, I think, and it was probably universal, the technical challenges we all took for granted. Everybody was very well connected, and the degrees and different platforms, trying to bring those together on a day-to-day basis was certainly a surprise for us, not only on the operational side, but also how we communicate externally. And the depth at which all of the issues, from transportation to food to shopping, the extent to which coronavirus was going to impact our lives was nothing we had really planned for. We go through these exercises, but to see it in real world. What did surprise me in a good way was just the resilience of our community, all this, and how quickly people could adapt business, their own in their own ways of behaving. That was inspiring in terms of a good surprise.
Yeah. And we should point out, Francisco, is we're thrilled that you're joining us, because I know you're not, you have a different crisis going on right now with tropical storm that has been hitting the coast down there. So we're glad you could join us, and we'll talk a little bit more about how you juggle multiple crises at the same time here a little later. So thanks for that. Ryan, how about here in Arlington?
Yeah, I'll do a good surprise and a bad surprise. I think I'll start with the bad and end with the good. But I think just how much mask wearing and some of the health practices that we're trying to sell and showcase to our community have been politicized. The negative comments and the input from the community it's been challenging. Coming from a TV background and journalism. You want as reliable of sources as you possibly can have. Well, the CDC, World Health Organization, all that stuff, you would think that would normally make you feel good about the foundation of the sources, but it doesn't matter where it seems to be coming from. There's still a mistrust there from some sections of the community. So that's been challenging. But I think a good surprise has been how close and how this has made our team stronger as a communications office. I think everybody's really pulled their weight, worked extra hours. I haven't had one complaint from staff as far as doing the extra calls to action that we've all had to take on. And our overall communication from a department-wide system has really improved as well. I feel like we have better relationships with all of our department PIOs and communicators because of this.
Yeah, good deal. And Jordan, how about up in Amarillo?
I'd probably say the biggest initial frustration and surprise for us was how rapidly guidance changed, and from the multiple sources. So we would get a piece of guidance, the same one that you all got, and we would put together some posters and some posts, and we'd get some, the graphics created, and before we could even hit the publish button, or sometimes right after we hit the publish button, everything would be different. So that was a big challenge for our team, certainly right away.
Yeah, absolutely. It seems like it's continually changing, and still is, as the CDC in the last couple of weeks has put out different information that has changed day to day, which can certainly complicate what we're doing. Well, before we get to our next question to the panel, we actually have a question for all the participants out there. In fact, we'll do multiple poll questions throughout this webinar. But our first one, the question is, which of the multiple crises that we've dealt with from March until really today, or if you want to go through the end of August, broke your shoelace, or in a way impacted you the most, maybe a different way to put that? The Black Lives Matters protest, coronavirus, the economic downturn, or Hurricane Laura, or now I guess we could throw in any of the tropical storms that they've had to deal with down in the Houston or Gulf area. So if you vote now, which one of those crises was the hardest one for you to deal with or cope with? Lauren, I'm not able to see the vote totals. Are people able to vote?
Yes, they're voting. We have 56 out of 70 people. I guess when I end the polling, it will show.
Okay.
80% have voted. Okay, it seems stop. So I'm going to end the polling.
And there we have it. All right, our results. Look at that. Well, yeah. So expected coronavirus, but it's interesting how we have had to in addition to coronavirus, juggle all these other things at the same time, which I think made our response to coronavirus even the more complicated, right? So let's kind of get to that question of the panel. You know, it's hard enough to manage that one crisis. How do you do those 3 or 4 at the same time and also, well, maintain your sanity, I guess. And I don't know who wants to jump in first on this one. Francisco, you've had to do probably the most of any of us in terms of the tropical depressions and everything else you've had down there. How did you do it?
Well, the good thing is on the emergency management side is we're paranoid folks, and we often have incidents within incidents. And people are wondering, how are you going to do coronavirus and hurricanes? Well, we did coronavirus and Ebola, hurricane season and Zika, hurricane season and H1N1. So we're used to that. What we were overwhelmed by was the complexity and the scope and the long duration of this event. And we're probably only through the first, quarter, maybe into the second quarter of this. So for us, we tackled it with one, addressing mental health. And I was very surprised for public safety folks how interested they were 2 months into this to actually be on these mental health webinars that we would have. Normally attendance is low. I mean, we were busting at the seams on that. So that was encouraging. And also scheduling, trying to make sure that we gave people breaks and that we watched out for each other. And also trying to just some humbling coaching talks with one another about the limitations of what we can do and that it's okay to go home because there'll be plenty of tomorrow and the next week and the next few months to deal with this. So those are probably the 3 ways we've been tackling that in terms of keeping our teams sane and healthy and energized to keep going forward.
That's definitely the truth. It will always be here tomorrow, right? The work doesn't stop. So anyone else?
I would say we focused a lot on remembering what was within our circle of control. And there were a lot of things that were not within our circle of control, but attitudes and actions and what needed to be done right now that we could have our fingers on really helped because, we're like Devin. Our public health authority is the county. So there are a lot of things with the data that we have no control over. And we had to accept that, because you do take it very personally as a communicator. And, we've done crazy things to keep our mental health beyond webinars. I delivered happy hour to all of my staff that are teleworking, and we did a Zoom happy hour together, just trying to make sure that we still did some things that felt normal, even though it felt normal in a different way. That's
an awesome idea. So you just drove around and delivered happy hour?
Yep, I recreated our team's favorite joints. We go to this pizza joint in downtown. So the appetizers at the table, I recreated that. And then I know what everybody likes, from sweet tea to old fashions, and everybody got the drink of their choice. And then we just did happy hour after hours.
What a great idea. I love that. That's because we we need that stress reliever, right? In the middle of all this. Devin, how about you?
So in the middle of all of this, we actually had the 1-year anniversary of our mass shooting that happened August 31st. And we also had a horrible economic downturn. The oil industry is really our bread and butter here. So we had a lot of negative feelings just in the community as well. And so I worked my staff very hard to get multiple projects out in multiple different languages, and they did amazing. I think the biggest piece of advice that I told everyone was, do not read the comments. Do not read, do not get caught up in the social media comments, because especially in our area, West Texas, we're a very different breed, a very strong and independent and stubborn breed out here. And they have their opinions and they stick to them. So I think a lot of times just logging off, don't read anything else, just go home and just be for a little bit. And I hope that they did that. I know it's hard sometimes to just log off.
Yeah. Jordan, what about up in Amarillo?
I think, obviously prioritizing, but really just getting to know your team and knowing where your team's strengths are, and then deploying your team, for those of us that have them, I guess, but deploying your team, not just in your own department, but throughout the city or wherever you can, gain help in the areas that they're strong, so that you've got the biggest players and the best players in the game that they're best at. It was a challenge, certainly. It's been a challenge for all of us to deal with a number of enormous things, but trying to just keep everyone focused on individual tasks that they were very good at was helpful for us up here.
You bring up a good point that some of us have teams, some don't, because we've got a lot of one-person shops, if you will. throughout the state. One of the things we did here in Arlington to kind of address that, we've got a team, but still the amount of work was so much that the team that we've got couldn't cope with all of it. So we recruited folks from other departments that had either PIOs or people that had extra time because they had either been, their normal job function didn't exist as a result of closures or other things with coronavirus that helped us tremendously, which would also apply, I think, to a one-person shop as well, because that we need those extra hands, frankly, and those extra bodies sometimes. I didn't mean to steal your thunder if that's what you were going to say, Ryan, but what about you? How did the sanity portion of this portion, how did you handle that?
Well, I think it's all relative for all of us. I don't know if we have our sanity back or if we're still trying to find it or what that all means, but I think it's all been redefined. But yeah, I think, you touched on it. For a long time, this became the communication office and our emergency operations and fire department. Those were really the two departments that were, facilitating a lot of this communication, and everybody else kind of had some downtime because we really weren't firing on all cylinders. It was all about, the health crisis and public communication. But I think for us, organization has been key. I think making sure we stay consistent. I think when we first started out in March and April, we were doing daily calls with our EOC, our emergency operations group. We were doing daily calls with our editorial staff. And we were also doing daily calls with our city department PIOs, just to make sure that we were all on the same page. Because in the middle of all this chaos, if we can be organized as we possibly can be, and make sure that we're filtering everything through the proper, process, I think that helped us quite a bit.
Yeah, good deal. Well, let's get to our next question. And actually, I think it was Devin at the beginning of this that kind of foreshadowed this topic, because it is something that we've all dealt with a lot, I think, which is the varying information we're getting, whether that's from the county or the state or the CDC, the Trump administration, your county health authority, that often is not your city, right? Or your own emergency management office or fire department. It's a lot of different channels that we're getting information from. So I'm wondering how you all manage those different channels of information in order to create consistent messaging. I think that's the key. How you keep that consistent messaging when you've got all these different things coming into you that didn't confuse your residents. And Jordan, how did you deal with that down in Amarillo?
Well, I think we focused on key core messages that we could rely mostly on as far as demographics. Or just metrics in general. We kind of stayed away from, at least initially, from reporting a lot of minutia, because that's where a lot of things changed 3 times a day. So we tried to focus on reporting the more key metrics that we could reasonably rely on, and then we were consistent in our sources. So we were right or we were wrong, but we were that the whole time. I think that helped. People began to see, that we weren't going to kind of flow with the wind of whatever was the most recent best metric. We kind of stuck to what we knew we could report accurately.
Yeah, I think that's smart. Sean, I know you guys have a very robust reporting tool on your website. Did that help you with this?
It did, but our biggest tool ended up being a massive FAQ document that we created. And, I'm still on the relatively new side to the public sector. I came out of the private sector. I'm now 5 years into public sector. And so although I'd done all of my PIO training with my FEMA courses, I still didn't really understand until I lived through it, the wonderful work that our emergency management friends do in terms of really project managing us through challenges. And so our daily task list then fed into an FAQ document. And I'm going to share my screen really quickly just to show people what that looked like. And hopefully you can see it now. This document, and gosh, it's 33 pages, which is not as long as it used to be, but it was at one point in time 43 pages. And this was just internal. We used it for our call center. Every administrative assistant in the entire city received it, every department director, and then of course the entire communications staff. So the benefit to this document, and it's all hyperlinked. It'll eventually be a wiki on our website for internal use. Is if somebody called in, if they emailed in, if they sent us a Facebook message, a Nextdoor message, if they stopped you in the street, you could give the exact same answer. And we started building that within the first week within the EOC, using that as our, our working list of issues we had to resolve. And so that helped us stay very on message and very consistent citywide.
So, Shauna, did the EOC actually, did that staff create this, or was it your team that created this? And who had the kind of ownership of it?
We created it. So this, well, you see I have a little weird page break in there. We were the master document creators, but we were not the owners of the content in terms of the answers coming in. You know, there are different sections for departments. Some of this is owned by our government relations department, some of it by our emergency management team, but we were responsible for voicing it, for humanizing it, and for making sure that it was consistent. And it was something that as we were answering questions in the EOC, we thought, let's just put this in a document so that we can go back and refer to it, because we were hearing the same questions over and over, and we felt like it could be helpful. And I'm sure everybody's town and city had the same experience, where when questions started coming, people called the first number that they had in their phone, and that might be the Action Center or that might be the animal shelter, and somebody needed to be able to give them help, and we really didn't want to see those individuals get transferred 4 to 5 times to get the correct answer.
Well, this is a fantastic idea. Is this in Google Docs that you did it, or how'd you make sure everyone had access to it, they could update it?
We did the updates through email, and then we issued the updated document as needed. But it lives on SharePoint in our COVID resources file.
Good deal. Well, that's fantastic. Ryan, how about here in Arlington?
Yeah, I think when we first started out, we were relying a lot on the county as far as reporting and cases. But I think, you know, as council kind of started to add some input, we wanted to make sure that we had a really robust kind of news center to make sure that all of our information was housed in one place. I think everybody did probably create some version of a coronavirus website, and I'll share my screen here to kind of show a little bit around here. But, you know, we really, and hopefully everybody can see that, but we really took it upon us to create almost a whole entire news page, not just a coronavirus site. It was really a coronavirus news site. And I think we published somewhere between 300, 350 articles since March. And so we've got, you know, a lot of quick links for our assistance resources from our nonprofits, so small business resources, as our county has put out a lot of small business grant information, you know, prevention tips. Obviously, I'm sure everybody has a lot of that. And then the testing that we have here in our community for a while was housed through our coronavirus website. That's where people signed up, which was a whole new layer. And we had to get our webmaster involved to be able to create those forms and make sure that it was functional. But yeah, and then you can see the news here. But I think having this site, and we've got some CDC resources down there as well. Having this site, the testing, updating our cases, has allowed us to keep everything consistent, make sure that we have everything tagged that's related to coronavirus.
I also thought that having that was easy for us to be able to direct people to, similar to what Shauna, you guys did on an internal basis. Externally, we were able to get kind of the messaging out and push it out to folks when we got questions. So it gave us kind of a repository, if you will, for that stuff, which is good. Francisco, I see you're unmuted. How about you?
So one of the things that we did is we sort of expanded one of the things we typically do during an incident, and that is our Regional Joint Information Center. We've got a 10th largest media market, 34 cities, 54 fire departments, plus a complex sort of area here. So we had daily calls at 2 p.m. every day like we do during a hurricane, but just for months on end now, about what is our messaging priorities, what's changing, and we go through the roster of organizations just because we know the truth changes from day to day, and that's fine. So part of that was also recognizing that. And also in terms of avoiding confusion, we tried to stick when possible to what we knew was going to be true for a while and try to push those messages on a consistent basis to deal with some pushback. And it's interesting, one of the things we had to do, we spent a lot of time watching other people's news conferences, because while we know what's happening here locally, you would have the state news conference and the federal news conference and the White House news conference. And so we had this entire afternoon blocked off of literally just watching TV. So by the end of the day, we knew what was the latest information to pivot to that. So
how much of that did it also inform how you do what you're like? Did you learn from others about this worked, this didn't, and informed how you then presented your information?
It did. And one of the pivots that we made very quickly was recognizing and trying to be very proactive and like, the truth is going to change and here's what we know now.
Right.
And that was critical, because sometimes, not through any bad will, but sometimes you would find out on the news conference from a state or federal partner something that was new. And so we would have to adapt to that. But in terms of some of those lessons, is just try to also source information out, right? So according to, we should typically do that anyway, but when you own something as a local jurisdiction, you're just saying, okay, here's the forecast, because we trust the source. But a lot of sourcing on that was critical for us to help, one, for credibility, but also point people to where that information would be coming from.
Sure. Devin, do you have anything from Odessa?
Yeah, we pretty much did everything kind of the same. We used the county's information to give out the daily numbers, and then of course, put a little asterisk that said, these are from your county, and we created a news site on our website because although we did not, we're not the health authority, the citizens were still looking to us to answer those questions for them, and for a long time they weren't getting any answers. Like I said, we didn't have our first case until maybe April 1st, which was a little bit behind everybody else, I believe, and our numbers didn't really go up and spike until about July. So we were kind of, just kind of easing along. And for a long time, a lot of people, residents got hung up on the county not releasing the number. People tested, not releasing the number, or really any sort of information. And so we had to take it upon ourselves to kind of get some information out there and really be that source, because up until then, there really wasn't any information out there. And it was unfortunate that for the residents to have to go through that. It really, really kind of made them distrust the whole information system. So we had to do a lot of backtrack to get that trust back. And it was an uphill battle for a while.
And I think a lot, you mentioned, you're getting the information from the county health authority. I think we've all dealt with that, but they're not, I don't think, the custom source that the residents go to. They're more likely to come to us, right? And in a like manner, I think we are all probably a little more attuned to the communication side with residents than the health authority is, and how you present that, make it look good on a website, or how you kind of make it all interactive. So we're using someone else's data, but then to really be the communicator for it, right? That the county necessarily isn't able to do. At least that's what we faced here in Arlington, for sure, in Tarrant County. Well, so we all use different channels, and some cities use them more effectively than others, and they work better in their community than others. So I'm wondering if you all could tell me what you saw as the best or most effective way to get the news out. Was it through your website? Was it social media? Was it video? Was it the daily briefings that you mentioned, Francisco? What was the most effective for your area or your city for getting the news out? Francisco, what you're a little bit of a different jurisdiction, that you're a health organization. So to emergency management, how'd you all do it?
So for us, we've had two health authorities, well, just in Harris County proper, surrounding counties as well, but we have the City of Houston and Harris County Health Authority. So it was always, when we had those regular briefings, we would have the mayor, the county judge, and both health directors there, and so that was helpful. What we found to get that information out between those was, for the first time, we started utilizing the short codes, those texts that you could text, impact or corona or something to our short code. And we had 25,000 people to date sign up for those, which essentially was 25,000 new folks that hadn't registered before. So we found that to be very effective. In addition to that, capitalized on a lot of live streams with our public health director, with our Office of Emergency Management, with medical professionals, and people seemed really to consume that well. So for us, those were the most effective ways to tackle some of that.
25,000, that's a great number. So
we were impressed.
Very cool, very cool. Someone else, Jordan, I see you're unmuted.
We still do a weekly press conference, and they were 3 times a week, and then we finally were able to cut them back to once a week, but they're redundant. We don't give out a lot of new information all the time, but people know that they can see it. It's at the same time every week. It's got the mayor, it's got city management, it's got the chief medical officers of our 2 hospitals, as well as the director of the VA Medical Center. It's got, the tippity top experts in the field will report on the condition once a week on our press conference. And I think that's been the most useful tool for us.
And is that because you had strong viewership on let's say, as you're streaming it on Facebook or on your website, or is it because that's where the media really tuned in and you kind of amplified your message? Which worked better for you?
It's been a little bit of both, to be honest. We initially live streamed it to Facebook, and we found that our live streams were getting overrun with negative comments. I will be glad to sit on a Facebook webinar anytime you want to hear about it, but you may not want to hear all my thoughts about it. But in any event, we moved it to YouTube to control some of the feedback, so that people could focus on the messaging coming from us. So we gained a pretty large audience quickly through the Facebook and then YouTube streaming, but our local news channels stream our Zoom press conference directly as well. So they just take our feed and send it right out. So we're essentially on they break into whatever's programming they have that day. We get complaints about that sometimes too, but we have great support from our local media in that regard.
Yeah, good deal. Ryan, how about here in Arlington?
Yeah, I think for us, I think our coronavirus website has been kind of the foundation where everything's been housed, and it's been nice to have that as a website as a go-to for us. And social media obviously is an incredible tool for us as well. But I really think our strength in video production has been a huge asset during this time, and doing kind of PSAs and making sure that we reach out to our stakeholders. And we've been really fortunate, particularly with our mask campaign, to have a really strong North Texas regional buy-in. So we were able to produce, and I'll share my screen here, a quick PSA with Mayor Betsy Price, Mayor Williams, obviously our mayor here in Arlington, North Richland Hills mayor, and we produced all of it in-house. And what was cool about it is, the messaging, you're going to be stronger if you're together on this, and North Texas is stronger together is kind of the theme we went with. And then Betsy, Mayor Price in Fort Worth had the y'all wear masks, so we coined that a little bit too and worked that in. But, we also were fortunate to have really strong, kind of those local celebrities. Kirk Franklin, who is a I think a 14-time Grammy Award winner. And he has a studio right here in downtown Arlington. And so the African-American community was in particular, and continues to be, one of the hardest hit communities for cases and spikes here for coronavirus. So we wanted to make sure that we had messengers and people that were reflective of our cultural diversity and wanted to speak to everybody. So I'll play this. It's 58 seconds, not too long, but I'll play this Kirk Franklin PSA. We wrote this script for him, and Taylor made it for his skill set as a musician, and he kind of added a little bit of his own flair to it. So,
hey, Texas. Kirk Franklin here from the Folio Soul Entertainment Studio here in downtown beautiful Arlington, Texas. I have something important to ask everybody, and I want to do it right now. And that's to please wear your mask. Let's look out, y'all, for everyone, for one another, and let's keep our families and friends and co-workers and fellow residents safe, y'all. Please. COVID-19 is still spreading, and it's going to take all of us to win this fight. Music has the power to bring everyone together, and we need that same togetherness in our communities. And we need it right now, y'all. So please be kind, be safe, be healthy, wear a mask, and help reduce the spread of COVID-19. Please, y'all. God bless.
So yeah, so that was Kirk, and we did one with Pudge Rodriguez that he did both for us in English and Spanish, the Hall of Fame baseball player for the Rangers, but utilizing those stakeholders and community partners. It had about 25,000 views on YouTube, but on Twitter it was shared by the governor's office and a number of others. So we were about over 100,000 views on just the Kirk Franklin video alone. The Mayor Price and Mayor Williams and Mayor Trevino video did pretty well on social as well. But utilizing those community resources to make sure that you can magnify the message to people who they actually trust and look up to.
And I think an important point on that is that not only if you've got celebrities, and I know Austin and Dallas and Houston used some of those as well, and used the kind of celebrities quite effectively, but you don't necessarily have to have celebrities for that to work. Finding a community influencer that is really important in your Latino population, as an example, Latino communication residents, and using them, just average citizen, but if they're a real big influencer for that, for your community, getting them on board can have a big difference, whether that's the pastor of the biggest church or whatever it might be. So you don't have to necessarily have celebrities for this to work, it seems to me.
Yeah,
Devin,
absolutely.
is that effective up in Odessa?
So yeah, we don't really have any celebrities out west. We have our local celebrities, and that was what we really relied on. In the beginning of all of this, I went to my city manager and told him, I need help. I need someone who can speak Spanish well and communicate, because we are 67% Hispanic, I believe, 67% Hispanic in Odessa. And so luckily, being in the TV business before, I knew exactly who I could call on. And so she is someone that is very good with video, but also very trusted. She was in Spanish TV news for about 15 years, and just offered her to come and devote her life to city government. And luckily she thought it was a good idea and took it on, and didn't really realize what she was getting herself into. And people truly just trust her so much because they are used to seeing her giving the news and used to trusting what she's saying. So when our mayor would do his Facebook Live videos, Magali Nieto is her name, and she would listen to the daily briefings and what the mayor would say, and then go and then do her Facebook Lives and post it to YouTube as well. And that really bridged the gap, that communication gap. She really is kind of our Spanish speaking PIO now. That is what she does. And people, you know, will call her. They feel comfortable with her. They'll reach out to her about resources, and it's been great. Her video production is amazing as well, and that's what we relied on, was video to get through to everybody, doing whatever we did in English and Spanish, but not just translating it, because she knows the culture and she knows the community and she knows how to get to them in a way that I don't. It really resonated on screen. So I'll always be grateful to our city manager for letting us hire her, and her being crazy enough to jump on board during a pandemic and not knowing what she was getting herself into.
Finding those trusted community resources like that is so important, and particularly in a pandemic like this, because we're saving lives as a result of it. So that's a big difference. Shauna, how about you? What worked in Plano the best?
Gosh, the best is hard, but I would echo influencers. Most people who know Plano know that we actually do run an influencer marketing program. We hold contracts with a variety of influencers, and that was really helpful, because if I had answered the original poll question on like what broke the shoelace, it was the day we said the pools aren't opening for summer, and it was very understandable, you know, why that was. If you were a parent and you had been homeschooling unexpectedly from spring break on, you were probably dreaming of throwing your kids in the pool, you know, and then to have that news come that the pool was not going to open, that was crushing. And so it was great for us to be able to call up for that particular incident, our influencer in that group that reaches 18,000 moms in our area, and to have a sit-down Q&A broadcast Facebook Live, 45 minutes long because of all the questions, just to talk through how the decisions were made and what the priorities were and what triggers might overturn that decision and what we would be watching for. It really diffused that situation fairly quickly. You know, it took about 4 days, but that's about the, you know, if you go through the cycle of grief, that's pretty fast, just 4 days. So, you know, I mean, we're just like everyone else. Social media is helpful. Our COVID site on our website is helpful, but those influencers who we work with ahead of time, and I tell everybody, it is not what you do in the crisis that helps you survive the crisis. It's all that work that you do before the crisis comes, because then you can call and you're calling on a friend that you've built that relationship with. And now we're in the next normal. So consider this, COVID's not going away anytime soon. Certainly tropical storms, since we're in the Greek alphabet, don't seem to be going away anytime soon. Start doing your work now. Figure out who your influencers are, your friends in the community at nonprofits and businesses, and start making friendships with them now. Start having coffee meetups over Zoom, because you're going to need them before all of this is over.
Yeah, it certainly helps to have these programs set up in advance, like you did, right? But it doesn't mean you can't start now. And in fact, maybe use this as a way to recruit some of those folks, because of the health emergency of it. You might find more success maybe in recruiting those folks. That's great. We've got another poll question for you, our participants in this, and that poll question is: have you had to rethink or change social media policies because of the viewer remarks that you've gotten? And in fact, one of our questions that we've gotten in the Q&A is basically exactly this, or pretty close to it. So let's see what the vote total is here. Again, Lauren, I'll have to rely on you to let me know when it's ready to go and what the total was. So not yet seems to be the winner here, or at least winning. Oh, now we can see the vote totals. Go live. All right, that's helpful. Getting close to. All right, well, as people continue to answer, it looks like got a few more coming in. As people continue to answer that and you leave that poll question up, let me throw this question to our panel. How did you handle the vitriol on social media? And again, this is one of the questions that actually came in through our Q&A as well. So we're all on the same page here and we've all seen it. How did you handle it? And did you have to change your policy? And if you did, how did you change it to cope with that? Shauna, you all had to deal with this a little bit, didn't you?
Yeah, Nextdoor was where it really got out of control, and I would get emails every day through direct messages on Nextdoor with either, this political side is overwhelming everybody else, and fit in whatever political side you want to, because I was hearing it from both sides. And it really became clear that people had individual agendas and they were just waiting, because we did an update every day. And we've had a philosophy that we engage in two-way communication with our residents, and it's really hard to have two-way if you keep the comments closed. So we never have. We would close them at the end of the day when the next post came. By the end of our daily posts, which we ended about 3 weeks ago, because data has been increasingly complex, and we've decided not to push it out on social media every day. I was closing comments just because it wasn't leading anywhere good. And the discussion we had internally centered around the question, at what point are you contributing to community angst and not community information? And that was a hard conversation to have, and a lot of different opinions. And I felt like I had a different opinion personally, every time I had the conversation, and we came down on the side of, we're not leading people to a good place by allowing them to have a conversation. And if they want to have that conversation, they can have it on Facebook, since we, don't have the ability to close comments there. And it did really help. We'll move forward with comments open, but probably not on a post about data, and not on a post about masks, certainly.
Looks like our poll ended up with the not yet winning, but we see that some have had to already change theirs. At least 23% have already had to. Someone else, what did you find? And we can take the poll question down there, Lauren, if you want. But what did you all find? Did you have to change something, Jordan?
Jay, I think one of the things that really, I don't think we saw coming, at least not to the extent, was the growth that we had almost overnight in our social media channels. I think we went from, we had our first case on March 18th, and I think on March 19th, we went from like 11,000 Facebook followers to almost 30. I mean, we nearly tripled within the period of probably 2 weeks. And with the additional people, we saw the additional detractors. And one of the things I didn't anticipate, another thing I didn't anticipate, was that the people using our audience for ads, right? So we were getting people advertising masks for sale and all kinds of things. So we were constantly having to monitor. Everybody else noticed our big audience, and so they started trying to take advantage of that by selling all kinds of things, or I don't know. So Facebook, social media in general, very useful tool at certain times for certain things, but not the most reliable. I think Shannon and I are probably in the same boat on a lot of these things.
Yeah. We've got a question from one of our participants here. They're seeing a lot more regular people who are waiting for us to promote mask usage on social media just so they can attack it. They don't post on anything else, but they come in on this one with an agenda. Have you all seen something similar, and how did you cope with that? Because mask usage really has been politicized, right?
We cope with it by not engaging in the conversation. We allow the conversation to happen, but we don't necessarily engage in the debate because it doesn't go anywhere good.
Yeah. So do we do, Ryan?
Yeah, I would totally agree with that. I mean, I think it's pretty obvious when they want a back and forth, and unless it's a direct question about a city need or service or something that we can provide from a positive standpoint, keeping that and fueling into the fire is usually something we avoid.
Yeah. Anyone else? Okay. Well, let's get to our next question, because I want to make sure we get through our series of questions and also are able to answer the participant questions as well. Coronavirus hit different segments of our population harder. Obviously, the African American and Latino populations saw higher rates of infection, higher rates of hospitalization and deaths. So what strategies do you all, we all come from diverse communities, I think. What strategies did you all have to reach those communities that sometimes I'm not sure we're engaging with on a regular basis or as effectively as we could? Devin, you mentioned that you've got, what, 68% Latino. I thought your one idea there was great. Did you have any others that kind of helped you get into that group?
We actually took our drive-through testing, our free testing events to the neighborhoods to be able to, instead of, it was kind of intimidating because the first one we had was at the Coliseum and there was a lot of triage and things that just made it, unattractive. So for our next round, we said we're going to take it to the neighborhoods that are historically Hispanic populated or African American populated, the parks that are in their neighborhoods so they feel comfortable coming to these testing events. It was absolutely free, and we had boots on the ground, taking all the precautions necessary, but kind of going through the neighborhoods to let them know, hey, we are going to have this free testing event. You can come. We're not going to ask any other questions except for just who you are, that you are an Odessa resident, and a way to contact you with these testing results. And that seemed to be in the summer. We have another one going on right now, and it's not been as successful, but I think it's just the climate of the time. But in the summer, that was incredibly successful. And we had a lot of people, bringing their entire families out, and we would provide them with resources, bags of information, front and back, English and Spanish, of what to do whenever after you've been tested, what to do if you test positive, because amazingly, there were so many people in our community who did not know and did not have the luxury to work from home or to social distance or to stay away from their grandparents because they live with their grandparents. So we took boots to the ground and really just went to those neighborhoods to make kind of more contact.
You mentioned putting things in Spanish, or in our case in Arlington, Vietnamese is one of our largest population groups. We'll put things in Vietnamese, but I'm wondering if you all find, is that enough? Or do you have to do a lot more? Jordan, do you have to, how much harder or many more steps do you have to go through to actually reach those communities?
Yeah, I think, I don't know how unique it is in Amarillo, but I think fairly unique anyway, that we have such a significant and diverse refugee population. So I learned about languages that I had never heard about before, and so I'm actually going to share my screen here real quickly if I can without breaking something. But we move forward like a lot of communities with kind of a colored level indicator for the severity of COVID in the community. But this level red doesn't mean anything to somebody that doesn't speak English and doesn't, move throughout the community like a lot of other folks do. So we worked with community partners to develop the translations for all of those different things I think we ended up with well over a dozen different languages, many of which I did not even know existed. And so not only did we have to figure out the translation piece, but we had to find out how to get into those cultures then, right? And for one example, the Karen population, I believe it is the one that it is it's a very small group, and they have their kind of defined cultural leader who happens to run a very small grocery store where they all shop. So through our community partners, we were able to make the connections to that gentleman, who then kind of gave us the approval and his blessing, and allowed us, I guess, to use his resources to push all of our information into that community. But it's just somewhere we never would have ever reached that population. There's no other way to do it, So community partnerships, huge for us, especially given the diverse population up here.
I think that theme of not only translating it, but making sure what you're translating and the way you're communicating is culturally appropriate is important. How do the rest of you, how do you manage that? How do you make that happen?
So one of the things that we did, aside from just the translation piece here, was also working with some community-based groups to help get that information out. We also leveraged chambers of commerce in those communities to other organizations, nonprofit groups, to help us amplify that message, but also relied very heavily on our health partners that already had a lot of in Spanish there's something called promotoras, usually the women in the community that go and promote better healthcare practices, and so we leveraged them to make sure that we would get into those communities as well. And just on the issue of politicization of stuff, if your office is Harris County Homeland Security and Emergency Management, sometimes that is not the most inviting name in some of those communities. So we actually learned to do that during various disasters, is rely on those communities, organizations that are there to help amplify that message as well. And we were happy to write the message, hand it over, and let them put their letterhead and their logo on it to be able to do that. And so I think on the Spanish front, we did fairly well. When you start getting nitpicked about what version of Spanish you're using, I think well,
Right.
I think that was a win that it got into that's all they were complaining about. We also did ASL. And did some videos on that and try to be innovative in that space. And we also did a lot of geo-targeting. We used things like Nextdoor and other ways to be able to communicate to neighborhoods, to be able to be a little bit more precise in how we get those messages out.
Yeah, good stuff. Let's get to our next question. I know several of you had to deal with national headlines in a way that some of us have not had to. That when the national media came knocking, in some cases beating your door down. And I'm wondering how you maintain your core messaging in that environment. Jordan, I know you all in Amarillo with the meatpacking industry, which really did have a ripple effect kind of nationwide between what's happening here in Iowa and other places. How'd you manage that?
Yeah, I mean, so when the news broke about the meatpacking plants, the phone didn't stop ringing. It was every show on every major network. I think we probably we kind of took a two-pronged approach. Number one, we didn't ask how high when they told us to jump. We didn't assume, because it was CNN, we had to immediately just jump in and respond as quickly as possible. We stepped back a little bit, made sure that what we could provide to them was relevant and factual information. And then the other question that actually my mayor brought up, which I thought was a really good question, was she said, how does our involvement in this interview, how does it benefit the city of Amarillo? Because that is our priority, right? That was all we really wanted to focus on is our involvement or our participation in this particular show going to have a benefit here to our citizens locally? And that just kind of helped to disrupt a lot of the politicization of the topics, and just to remove a lot of the question marks that we weren't sure if we wanted to answer. So we focused on core messaging and focused on messaging that really was beneficial to our audience here in Amarillo.
And Francisco, did you have the same when you saw the spike in hospitalizations in Harris County and in Houston, where it was really making the national news all day long? Was the media just beating your door down?
Yeah, it was pretty consistent. And everyone saw sort of the national narrative. No matter what national news network you saw them start kind of descending on. And we saw that it was coming, because you would see across the lower part of the TV screen, the next big city is this. And so we knew eventually they would come here. And so we try to be very careful by focusing strictly on the local issues and not going into sort of national discussions, and try to keep it local. And then I'm a strong believer that the interview is not just, you don't do an interview because someone's asking you to. You do an interview because you have a message to get out. So if they're going to put a camera in front of us or ask us for something, we're going to provide the answers, the information we want to provide as well. Obviously be respectful of the questions, but an interview from my standpoint, and the way we approached it was, we have a message to get out, and we're going to use it as an avenue to do that. You
talk about media narrative, though, and I think that Houston fit into what the media narrative at the time was, which was cases are spiking and where it's out of control. Did you have to fight back or correct anything the national media was putting out there at all, or did you just let it be?
We had to do a couple of things, and one, it was just challenging. One of the hiccups that we had was data, and everybody having different versions of data, and it's a problem we still have today. And we probably won't solve that until this is over, unfortunately, and it's just one of those challenges. So it's difficult to sort of push back sometimes when what we're doing is trying to make the best decisions we can with different data sets that are pointing to a certain direction. So we'd have to push back on some things, but largely there were sort of minor issues. We were lucky in that we sort of didn't really become a lightning rod in terms of some of those issues that you saw in other parts of the country.
Sounds good. By the way, I think this was scheduled to go to 1:15, so we're nearing our last couple of questions, and we'll weave in some more of the participant questions as well. But we've got a few more minutes here with our panel. Let's shift to internal communications. And Shauna, I know that this is something that Plano does well all the time, which again is probably to your benefit as you end up with a crisis, right? And how do you kind of weave that into it? But it's often the forgotten thing that a lot of cities, just don't get to because they're too busy with the external component. But really important during a crisis, right? What did you all do that helped in that venue, in that area?
Certainly. So we have a very strong partnership with Human Resources here in the city of Plano. They are content creators. We are content optimizers and distributors, and we also partner with them on key messaging. So that didn't change in terms of how we communicated with our staff. But one thing that we did do in the EOC from the very beginning was just kind of create a framework. And for us, one of those guidestone principles that we set, and I wrote it down so we wouldn't forget, and that proved to be very useful, was that our philosophy was people first. And so we were always going to be thinking of people first, which meant if a staff member tested positive for COVID, the department director would notify the staff, and then the city would notify the entire city in terms of the organization. So city manager would then notify the city, or we would do it through communications, and then we would notify residents. We didn't want, we wanted to be respectful of the natural relationships that existed. So we wanted to, I guess, control water cooler talk for a certain, to a certain extent. You didn't want to say, oh, I heard somebody in TS tested positive for COVID. I wonder what that means for me. So we were always very upfront and provided some guide rails for people. And that became important later on, that we had to remind ourselves, hey, our people matter the most, so as we're making this decision, what impact is it going to have on people? And let's make sure that we communicate that out. So we did do communications for a while. It was every day. Then it became 3 times a week, sometimes 1 time a week, where we would email with a special template out to all of our staff, and we printed copies and put them in those service trucks for those who were still frontline workers out driving trash routes and signal routes and things like that. Notes to them, hey, Team Plano, this is what's happening. You're going to see COVID cases ticking up because of this data that we're seeing from the county, and here's what it means to you. Hey, parents, spring break has ended, and now we know that your kids aren't going back to school. What does that mean for you? What does that mean for your job? How are we pivoting? You're our first priority. And we also set up, I'm sharing my screen, we set up a secondary website. We have SharePoint, for internal kind of lockdown within the city, but this is an internal, external website, so retirees can access it as well as spouses, partners of our staff. So this is our teamplano.us. I don't have any concerns with you all getting to this. If you want to look at this site, it's teamplano.us/COVID-19. And it is a complete resource page for our employees. Everything they needed to know, from return to work to FAQs that they might have. We pushed out video messaging on a regular basis directly from our city manager, speaking very from the heart to our employees, because we wanted to know that they were seen and that we cared about them. And our message was always consistent. Team Plano matters the most to us. You are our highest priority, and the decisions we're making for the city are being made with you in mind. And you would hear that all the way through. We did a lot of thank you messaging, and we made sure that we continue that forward and send out internal training that was tied to, hey, you're working from home, here's how to use Skype, here's how to use Zoom, here's how to know whether you should use Zoom versus Skype, here are mental health training resources. And we even pivoted that during the social justice protests to talk about, here's how we talk cross-culturally, here, let's have some crucial conversations and have facilitated conversations. So they were our priority, and they knew it because they heard from us frequently. And they also had a direct line that they could email their manager, their supervisor, they could email me. They were on the phone with Risk, and we always took their calls, and it didn't matter what time.
I don't know about the rest of you all, either on the panel or in your offices or at home watching this, but I feel woefully inadequate on internal communications now after seeing all that you guys did. That is phenomenal. And so much of that is stuff that we either didn't have time to get to. Do you have someone that's dedicated to internal comms, Shauna?
I do. I have one staff member that I've put. She originally handled multiple departments, and then as we really doubled down as a city, because we're competitive with you all, we want to keep our staff as a city, we all steal from one another. We felt like we just needed that one person, and that doesn't mean that she's creating all the content, but she really is corralling it all the time and staying on top of what needs. And she's also the heartbeat of our team, because she'll say, she gives us that feedback that we don't want to hear. Hey, we're making this decision. She said, did you think about the person who's about to retire and how they're going to receive that message? So it's been very, very helpful to have her.
Oh, that's fantastic. Anyone else on internal communications? And I guess I would throw in there, how hard is that if you were doing a lot of internal communications to get the communication pushed through or approved either through the city manager's office or through the EOC or the human resources or IT? There's lots of different layers that could factor into that. Did you find those as hurdles, and how did you overcome them at all?
For us, it was pretty standard practice. So in the Emergency Operations Center here, we have the Joint Information Center, and it's not just public information. We have 3 audiences that we tackle during a crisis. The public, obviously, our media, and our partners and our stakeholders that need different sets of information. So that entire structure communicates to all of those different audiences. So a lot of that internal communication was just within the county and also within the response network. So for that, we found it pretty, so we had the infrastructure. So for us, that was helpful. We did supplement that though, because it is because it continues to be a moving target. Just those email notifications and those updates can leave a lot of space for either misinterpretation or just a lot of noise as people are sorting through that. So we supplemented that with daily calls with our county departments, and as we moved to three times a week, and now as it's a little stable, once a week. But we'll be able to adapt and make sure that we also had a conference call component to update folks aside from the emails they got from us.
Yeah. That's awesome. Well, let's get one more poll question in here. And this last question deals with kind of as we look to the future, or maybe some of the opportunities that we've had as a result of the coronavirus pandemic. Did your social media accounts or your website views explode over the course of this pandemic since March? So have you just seen a huge uptick in those communication platforms as you're pushing that information in? Are you really tracking it? And as people are answering that, Pam, I'd like to get around to everyone on this. And in fact, we've got some questions related to it. Tom Bryson and Bridget Saxton both kind of asking, what are the takeaways moving forward that can help us in communications to do a better job? And I think that's really where we're getting at. Social media, as we're seeing here, at least 87% are saying yes, it has made a huge impact. And that's something that will carry us forward. What else are you seeing as a result of coronavirus that will help you moving forward? Ryan, do you want to start?
Sure. Yeah. I mean, and I think some others touched on it really well, Francisco and Jordan, but I think the diversity communications need is something that, it became very apparent during COVID, the need to be able to communicate more with our Latino community, our Vietnamese community, and those translation services that we've incorporated, and the more that we're doing with that, I don't see that going anywhere. I see that actually only enhancing and becoming a better mouthpiece for our entire community and make sure we speak to our rich cultural diversity.
Yeah. Looks like we got our final results there. 80% have seen an uptick in this, which means I think 80% of our respondents are out there saying that maybe there are some good things to come from the coronavirus pandemic, which is great. Devin, what are you seeing in Odessa? What's going to carry you forward into the future?
So I think everybody really appreciates the fact that we are bringing that Spanish messaging to them. Everything that we do in English, we're doing in Spanish, and maybe we're doing different things in Spanish that wouldn't apply to our English-speaking residents, and we're just making sure that all of those bases are always covered. Like I said, we have a big percentage of a Hispanic population, and we realized that, inadvertently we were ignoring communicating with that population, and it took a crisis like this to bring it to our attention. But that was kind of the silver lining of it, is making sure we get those residents informed.
Francisco?
Yeah, a little bit along what Devin said. I mean, we had our standard Spanish language communication, but sometimes we get in this incident and we walk away like, man, it would have been nice to do this, or that would have been great, but we didn't have the resources. But hurricane's here and gone in 5 days, so we didn't get to do that. Because this has been a long haul event, we've been able to specialize and tailor some of that messaging to very, not just Spanish language, but how do we communicate for folks in the immigrant community that are concerned about getting a testing? How do we communicate folks in the African-American community dealing with some cultural issues? And so having the time to do that, and the resources that were made available to do that was something that I hope will move forward. And additionally, we've in reaching some of those pockets, we've had new partnerships that we didn't have before. And so we'll be at this at a while with coronavirus. So our hope is those relationships will be maintained, and that we'll be able to leverage with those community partners that we have, whether it's a hurricane or a chemical incident or an ice storm. So having that in place, I think, will be in the long run something that's beneficial to us. And again, those folks carrying that voice in those communities simply amplifies that, and I think has a much better impact than if we're the only ones saying it.
Agree 100% on that. We've already formed some great partnerships as a result of this, and it's a good thing to come from this for sure, I think. Jordan, what about in Amarillo?
I mean, yeah, certainly community partnerships is huge. We've made so many new relationships. We've built so many new bridges that we didn't either have or didn't even know we needed in some cases. And then, technical takeaways like, we're experts at live streams now. We can work remotely when in the past we wouldn't have even considered trying. We use Zoom as a verb, there's all these things that we didn't know we needed to do, and now we can. So I think each city's gonna find that they've got gaps that maybe they didn't know they had that they've now been able to fill, and everybody's gonna find their individual ways of improving based on those.
And Zoom is the new Google. We use it as a verb. I like that. Shauna, what about in Plano?
Well, teleworking obviously is something that's going to be something that we're interested in looking at long term, because we were already in the cloud. We just didn't make the pivot to working from home until we had to. But what I personally, on the communications side, I've been surprised at how that centralized FAQ system really revolutionized how we communicated. And I've had this long held desire to see a little centralization of customer care. With customers being our citizens and our business partners. And so I think we're moving towards that. Certainly, at least on the information side, we're building a giant wiki version of that COVID FAQ, but just an FAQ for the city, and we're going to beta test. Can we provide a centralized answer system where we have, group collaborators updating that FAQ? Will serve as owners and of the content at the whole, and see if we can't do a better job. We think we do a great job of customer care, but we think we can do better. And so I'll be interested to see how that plays out.
That's great. Well, we've got some questions that I want to make sure we get to from our participants here. Arnett Murray is asking, what can be done as leaders to calm the fears of your constituents? There's so much uncertainty and so much unrest. And I think that dovetails along many of the crises that we're dealing with right now. It's not just what we're dealing with coronavirus, but it's the economic downturn, unrest from the social justice side of it. How would you advise folks to kind of calm the waters a little bit?
I would say consistency in messaging again. As long as you can continue to show your agency or your organization as an authority on the information, and that you'll provide it, whether it's good or bad, and people can learn to rely on you and to know that at least they're going to get the facts. The more you can establish yourself in that position, I think the more you'll help to kind of calm some of the fears that are out there, because at least people will know where to go.
Yeah. Francisco, I noticed you unmuted.
Yeah, for us, just being very candid about, the truth changes, and we're going to, we'll give you the information as it changes, and just being straight up and honest about that. And the other thing we have to recognize, I think, because we're the official source of information doesn't mean we're the most trusted source of information, and some humility in that regard is important. And I think what people have been doing, whether intentioned or not, is having these partnerships that we've all talked about, whether it's business, faith-based, chambers of commerce, community groups, being a part of delivering that message. Adds that sense of this is a community response. We're helping to sort of corral that response and lead that response. But I think that helps dealing with some of the trust issues that are out there. And so I think that's critically important. Having those partners at the table and be a part of that helps address some of those challenges.
Yeah. We got a question from Marissa Barnett, who's asking, because a lot of us have talked about translation, and she's asking, what kind of translation service do you all recommend? Are you guys doing your translation in-house, or are you using a service for translation? How are you handling that, Jordan?
For us, it's community partnerships. Again, I haven't found a reliable kind of third-party software or service that is the combination of cheap and quick. On day 2, we were using receptionists who happened to also speak Spanish. And then, slowly we built those relationships, but you'll find them. Those exist in your community. You might have to dig a little bit, but find those people. They want to help. They want the information too, and build those bridges, and you'll find that people are more than willing to give you a hand.
Sean, I noticed you unmuted. Did you do the same? You're kind of nodding.
Yeah, I was going to say we did exactly the same. And honestly, we used our library staff too. We speak a multitude of languages within our library. And like many other cities, we had staff we had to redeploy because they couldn't serve in their normal function, and that was a really helpful thing. We do have a lot of paid translation services that we'll use for things like bonds, where it's like really important, it's going into print. It's not that I didn't consider this information important, but I 100% agree with Jordan. Speed was really critical, and I didn't have time to send it off to a service. Even if I could find the budget, I needed to get it done in a close to good enough to get it out the door.
Kathleen Vaught has asked, she's seen an uptick of negative comments over the last 14 years. I think we've all seen that, right? But her question is like, now those mean negative comments are coming on simple posts that could be completely unrelated to coronavirus or wearing a mask, like conserving water or something that seems benign and should not be controversial. Ryan, how do you handle that when you get, all that negativity about, let's say, coronavirus, but on every post that you put out there, even if they're not COVID related?
Yeah, I don't think there's an easy answer. I don't think you can be deterred by it from an education standpoint. I think we saw negativity just about, and Shauna mentioned it too, from both political sides of the spectrum. But as long as your information is being vetted by proper sources, you're educating the community, and you feel confident in the information that your emergency management officials are helping you produce. I don't think there's any heartburn you should feel. The negativity is not going to stop. I mean, we're going to be in this for well into 2021. And so, being able to balance that. But, I think it goes back to our social media policies, making sure if you have made changes, make sure that you're consistent when applying them. And particularly in the comments section, we have one that we're pretty loose on the interpretation as far as not being germane to the topic. And so I think that may be able to help if you work some of that into your social media policy. But, we try to be as consistent as possible. We hide comments that violate our policy. We don't delete. And yeah, unfortunately, I mean, the negativity, I don't think it's going anywhere.
We live in a much more negative world now. Shauna?
Yeah, I was just going to say also, it doesn't help the negativity, but it does help your frame of mind when you're reading through those. Just remember where people are coming from. Everybody has been impacted by this pandemic in one way or the other. Job loss, they can't see their family. I know Kathleen asked that question, and she and I have talked about aging family members, not being able to hug those folks. Like, those are very real feelings in addition to feeling cooped up at home. And that's what's driving craziness. And it's crazy in any aspect that it can seep out of. And so if you know that that's where that's coming from, it still might make you mad. It might make your head explode. It feels very frustrating, but it does give you permission to say, I don't have to answer that, because they're really just using this as a valve release.
Yeah, I agree with that 100%. We just don't know where people are coming from. You may be at home with 3 kids trying to homeschool and do a full-time job. That's a lot. And single parent. I mean, how do you manage all that? That's tough. Sarah asked a question. This will probably be our last one because we're running out of time. But did any of you have any elected officials that maybe stepped out and said something public that wasn't maybe in agreement with what the public messaging was, or the messaging that your city or agency was trying to push out? How did you kind of correct that or massage that and handle it, I guess, in correcting it, or did you just leave it alone? Did anyone face that?
So we didn't face it here in Odessa, but a city close to us, their elected mayor just kind of came out the other day and said, open the bars. If y'all need to survive, you can survive. And it's not our municipality, but they're 15 minutes down the road. So we share the same fans on Facebook. And so we got a lot of, well, where is y'all's mayor? Why aren't y'all doing this? Or, just kind of the back and forth. But our thing has always been, the governor is the one who supersedes everything. He's the one who's making the laws, and we have to follow what he says. So that's been difficult because they kind of see us as the same, we're the same, but their messaging has been incredibly different, and their take on things. You can even tell, during council meetings, they went to in-person a little bit sooner than we did. We just transitioned back into a very socially distanced, mask-wearing council meeting. So it's funny to see the proximity of the two, but also the differences, and how that has seeped into ours. So we've had to go around that, and we've also had to deal with a lot of our people going over there to go out, and then now we're having to face okay, well, if they go over there, go out, now we have to kind of up testing. It's been fun.
it underscores the interconnected world that we all live in now, right? And so when we did the mask campaign with 3 different cities in Tarrant County, it was really because if we're not doing it together, if people aren't abiding by it in North Richland Hills or in Fort Worth and we are in Arlington, we're going to see an uptick here too, because we're just too close, right? So I think that's really relevant. And I will end on this note, but I do think it's helpful when you can say this messaging is coming, or this decision is coming from the governor's office, and we're following the state, and kind of use the state and or the CDC or the federal government as your cover, can be helpful. So I 100% agree. Well, panelists, you've been fantastic. I know you're all busy. We can tell, frankly, from all the answers you were giving and the work that you've been doing, and the work that you shared, that you're busy. So I'm so appreciative that you were able to take the time to join us today and to share some of the insights that you've had around coronavirus with the rest of our membership and other communicators here in Texas. We're really grateful, and we're lucky to have you all communicating, and I hope your communities know how lucky they are to have you all working on their behalf day in, day out. So thank you so much. Well, I thank all of our participants out there. We really do appreciate you joining in as well and asking some really good questions. I think this is a great engagement tool for us to really all up our game. And as we often say, there's no need to recreate the wheel out there. So if you see some good ideas, steal them, or reach out to any of the panelists, or to me, or to Lauren Grossman with TML and Tamio, and ask those questions. We're happy to get you the resources or connect you to the right people, so you don't have to recreate the wheel. But this has been fantastic. We will post this on our website as soon as we can get kind of downloaded and then uploaded again into the website. So we'll let you know when that happens. And then finally, we will have a Zoom kind of questionnaire as you log off. We'd love to hear your feedback on this and suggestions for future topics. Speaking of future topics, we will have an October webinar, and we're hoping that will focus on social media, particularly Nextdoor and Facebook, 2 of the platforms that we've all talked about here today that we deal with on a regular basis. So tune in for that. We'll have more information about that out here in the next few weeks. But again, thank you so much. We appreciate your participation, and we'll see you next month.